Tell me, let's start with high deductibles. What's that mean? Well, for that matter, what's deductible mean?
Well, a deductible is the amount that the patient or the member will have to pay before an insurance company will begin to pay anything. And on most typical PPO plans and HMO plans, that deductible tends to be pretty low, or it's just related to hospital care or diagnostic services. But the new plans, particularly on the Affordable Care Act, those plans have high deductibles, and those can be very high, particularly for single plans. I mean, a single plan might have as much as a $6,000, $8,000, or even $10,000 deductible, and that means that the patient, the member, has to meet that entire deductible before the insurance company will start paying anything. So it can be very high cost and very costly for the patient. That amount has to be paid to the facility, to the doctor's office, to the hospital, to the diagnostic imaging place where the services are incurred.
Before their insurance kicks in.
Before the insurance starts to pay a dime.
And the high deductible also, though, may offset that a little bit with a lower premium.
That's correct. That's the advantage to the high deductible plan. You're saving a little bit on your premium, but you're absorbing the cost as your out-of-pocket costs.
Okay, now, you use the term HMO and PPO. Tell us what the difference is.
HMOs and PPOs are pretty similar, but an HMO is going to have a little more narrow of a network, so you're going to have a few less choices for your providers or your hospitals and centers to go to. A PPO will have a little broader network. An HMO also may have a few more rules related to referrals and pre-authorizations and steps you have to go through to get particular tests done.
And if you're looking at choosing a plan and you're interested in staying with a certain doctor, you need to make sure that doctor is part of that network.
Absolutely, and those networks can change quickly. So usually most of the plans have updated provider directories on their websites, and that's probably the best place to start.
All right. Sometimes when you get a bill and you get information back from the insurance company, it's called EOB, or Explanation of Benefits. Explain that to us.
Yeah, an explanation of benefits, you should receive that every time you receive a service, and it's going to have a lot of information on there, a lot of it confusing. People really get freaked out by the charges that the facility charges, but really what matters is what that facility has negotiated with the insurance company or vice versa. So the allowed amount or the approved amount is really the biggest thing to concern yourself with instead of the charge. And within that EOB, you'll see a column for coinsurance, a column for deductible, and co-pays may also be on that EOB. But ultimately, you're looking for the member responsibility or the patient responsibility, because that's going to show what you are responsible for to pay that particular facility.
Okay, and in terms of paying people, there's a facility fee, there's a doctor fee.
Yeah.
Difference.
I think that's a confusing part for a lot of patients, particularly when it comes to diagnostic imaging, CT scans, MRIs, X-rays. When you go to a diagnostic center to have that procedure done, you will ultimately likely get two bills. You'll get a bill from the facility that actually did the procedure, the hospital, the diagnostic center for the actual test, and then you may get a bill or should get a bill from the radiologist or the physician who actually read and interpreted the test. And a lot of people get confused because they get that first bill and they think they're done, but then that second bill comes maybe a couple weeks later, and it can be a shock sometimes.
Now, Medicare is a big player, but there's different ABCs of Medicare. Explain them to us.
Yeah, there's different Medicare plans. Part A is typically your hospital. It is hospital care. Patients typically don't have to pay a premium for that, but there are co-pays or co-insurances and deductibles associated with that. Part B is the part of Medicare that covers physician office visits, diagnostic visits, and more outpatient stuff. The patient has to pay a premium to Medicare for that Part B, and also has a deductible and co-insurances. It's typically 80/20, and then Part D is your prescription drugs.
All right, now, and prescription drugs can be important because that's getting to be pretty expensive.
Absolutely, absolutely, and that Part D plan will, has a cost to it, and the patient will have to pay for that as well as their share of the drug costs.
Now, tell us what a Medicare Advantage plan is.
Yeah, traditional Medicare versus Medicare Advantage plans. Traditional Medicare plans are going to be, through CMS, the government, and that plan, will typically be wide open. You can see any provider you want that participates with Medicare. There will be, some deductibles with that plan and co-insurances. But the Medicare Advantage plan is more of a commercial product. That plan is typically an HMO or a PPO, so the network is a little bit more narrow, and you may not be able to see every doctor that you want to see, or that by choice you'll have to go to whoever's on their choices of provider network, and that may have co-pays attached to it as well.
Great information.